Welcome back to the Deep Dive. Today, we're wrestling with a scenario that, well, if you're an ambitious practitioner in aesthetic medicine, it's probably keeping you up at night. It's that really uncomfortable truth about flawless technical results.
It really is. It's that moment, when the perfect treatment just hits a wall of reality. You've delivered the precise amount of toxin, you've sculpted the jawline beautifully. Maybe this is even their third or fourth session.
They should be thrilled.
They should be. And yet, 6 months later, that same patient sits down, and you can just feel the disappointment when they ask, I look different, I know that, but why don't I actually feel different?
And that is the core disconnect we're tackling today. You transformed the face, but their internal sense of self, their whole identity is still stuck in the past.
Right, and that gap, it's not just some philosophical issue. It's the #1 killer of patient loyalty and, long-term retention.
So our mission today is to dive deep into the brain science that explains exactly why that physical transformation can fail to stick mentally, and then give you a framework to fix it.
Absolutely. Our source for this deep dive is a masterclass offered by Dr. Ari Masudi. He's a molecular biologist, a former researcher in regenerative medicine, who's now pivoted to become a science tech business consultant, specifically for the world of beauty. And his work provides this really rigorous neuroscience-backed coaching framework. It's designed to make treatments stick at that identity level.
Okay, so let's be really clear. We are not talking about some superficial marketing campaign or, generic motivational advice.
Not at all.
We're talking about practical brain architecture, understanding the specific neural networks that are actively sabotaging your otherwise perfect results. Because if you can integrate this, you're no longer competing on price or how fast your device is, you're competing on transformation depth.
Which, as we'll see, fundamentally changes the economics of your practice. Our promise to you is that we'll synthesize the key insights that let you go from being a highly skilled injector to being a true transformation specialist. We're cutting through the noise to give you practical, actionable tools.
Okay, so let's unpack this. We have this patient, they've just received excellent dermal fillers, you can see the improvements, but they still struggle. They might even be avoiding the mirror. Why does the brain actively reject the physical change?
Well, because that rejection, it's rooted in neural pathways that the patient's been reinforcing for decades, for years and years. When practitioners only focus on the external anatomy, they're asking the patient to accept this massive internal change, but without replacing the faulty neural wiring that's running their identity.
It's like putting $1 million paint job on a car with a cracked engine block.
Exactly. That foundation just weren't whole.
And Dr. Masudi, he details 4 critical brain networks that are all kind of conspiring against this new, improved self-image. It's really important to understand these because they're the internal roadblocks to your success.
Yeah, the foundational problem, it starts with the default mode network, or DMN. Think of this as the brain's narrative center. It's constantly playing the patient's core self-concept, that old negative story that says, I'm aging poorly, or I am just not attractive enough.
So it's their brain's idle screen.
It is. It runs in the background whenever they aren't focused on something else. So even when they look in the mirror and see a great new profile, the DMN is immediately whispering, yeah, but remember how you used to look? Or that's not going to last.
Okay. And the DMN has a partner in crime.
It does. The salience network. This network is the brain's internal filter. It decides what information is important enough to even pay attention to. And because the DMN is stuck on that negative script, the salience network is totally biased.
So it filters reality through that negative lens.
Exactly. It discounts every compliment, it ignores the actual improvements, and this is critical. It amplifies any tiny perceived flaw they might still spot. They are literally wired not to see the successful results you delivered.
That explains the fixation. The outcome can be technically perfect, but the patient zeroes in on some tiny, maybe even imaginary asymmetry because their brain is just looking for threats.
It's a huge insight. And then, if the DMN is the story and the salience network is the filter, the next 2 networks explain why they can't break out of the pattern. First, you have the central executive network, or CEN. This is your higher level cognitive control, working memory, goal maintenance.
So if the DMN is the old story, the CEN should be the editor, right? It should be writing the new chapter. Why doesn't it?
Because it takes a tremendous amount of energy and focus to override the DMN, which is so emotionally charged and deeply grooved. The CEN just struggles to maintain attention on the positive change. It's too busy being distracted by that constant hum of self-criticism.
And then the 4th network just pulls them right back down.
Right. The attention network. This is heavily influenced by the other 2, and it just constantly drags the patient's focus back to comparison, to scrolling social media, to that whole flaw-fixing obsession. The brain is just efficiently seeking out problem, not your solution.
Wow. So the clinical takeaway here is just profound. If you only treat the external, you're building this new confidence on wiring that is designed to fail.
The true goal according to Dr. Masudi, is deliberately restructuring these four networks. You have to help the brain accept what the mirror shows by giving it a new story, a new filter, and the focus to maintain it.
And this is where his six-step framework comes in.
Yeah.
It ensures the consultation isn't just a treatment discussion, it's a neural prep session. Let's start with the first three steps: preparation and vision.
Okay, so step one is immediately compelling because it seems so counterintuitive for a busy clinic. It's reclaim attention control using a vagus nerve hack.
Why is regulating the nervous system the absolute first thing you have to do before you can even talk about fillers?
Because you simply cannot have transformation in a state of stress. It's impossible. When patients are constantly scrolling Instagram, comparing themselves, their amygdala, the brain's fear center, is just chronically activated. And when the amygdala is active, it blocks the prefrontal cortex. That's the part of the brain you need for rational self-awareness, for planning, for any kind of identity change.
So you literally can't discuss them becoming their best self if their nervous system thinks a saber-toothed tiger is chasing them.
Precisely. The goal is to shift them from that sympathetic survival mode to the parasympathetic growth mode. And the solution is so simple: a vagus nerve regulation technique. Just 5 minutes of controlled breathing. The protocol is a 4-count inhale, followed by a slower, regulating 6-count exhale, and you repeat that 5 times.
Okay, I have to push back a little here. That 40% higher treatment satisfaction score linked to a 5-minute exercise? I mean, that's incredible. But what's the real resistance practitioners have to spending those 5 minutes?
The resistance is always time, always. But the solution is structural. The practitioner doesn't need to do it. You train your intake staff or your nursing staff. This 5-minute protocol happens in the consultation room before the doctor even enters. It lowers anxiety, improves cooperation, and immediately frames your practice as one that cares about their internal state. That 40% gain is just too valuable to ignore.
That does reframe the value proposition completely. Okay, moving to step 2, clarify their true aesthetic vision. The trap, you said, is asking that problem-focused question. So, what bothers you?
Right, that question just fires up all those old DMN pathways. It just reinforces the problem. The reframe is to activate the solution pathway. You ask, describe in vivid detail the best version of yourself you are becoming.
Can you give us an example of how that plays out?
Sure. Say a patient comes in and they're really fixated on their jowl. If you just stop there, you're fixing tissue. But if you ask the deeper question, you might discover she's actually seeking to restore her sense of presence and confidence at her daughter's wedding, or maybe to feel like the leader she knows she is in the boardroom. Now you're treating emotional presence and personal power, not just skin laxity.
And that emotional specificity is the key, because it activates the brain's GPS system, the reticular activating system, or RAS.
Correct. The RAS filters billions of data points every second. If the vision is vague, like fix my jowls, the RAS doesn't know what to look for. It stays focused on the problem. But if the vision is vivid, I'll be present, wearing my red dress, making impactful eye contact, the RAS starts filtering reality for every tiny improvement, every compliment that moves her toward that specific emotional goal.
So this means practitioners should be using something like a multi-sensory vision clarification form. What should that actually ask?
It has to go beyond sight. It needs to ask, what will you hear? Compliments, maybe your own confident voice. What will you feel? Relaxed posture, self-acceptance. What will you do? The more senses you engage, the stronger the neural pathway you are building for this new identity.
Okay, let's move to step 3. Identify and neutralize mental obstacles. You've clarified the vision, but now the fear pops up, the hidden saboteur.
And those fears, people will think I'm vain, or what if I look done? They are active neural barriers. That's the amygdala firing off threat signals, ready to undo the whole transformation.
So the intervention is actually really simple, but potent. You just bring the fear into the light.
Exactly. Research shows that just naming and labeling an emotion reduces amygdala activation by as much as 30%. You have to proactively raise these fears. It's totally normal to worry about looking overdone. You normalize the fear, which immediately defangs it.
What about post-treatment? When they're healing, maybe they're swelling, and that internal doubt voice is just screaming.
That's vital for integration. You coach the patient on metacognitive awareness. When that doubt voice starts, they learn to respond to it like a nervous friend. They witness the fear, I hear you, you're trying to protect me, but I've chosen this, instead of being controlled by it. This lets the healing process, both physical and psychological, move forward.
That sets the stage so well for the final 3 steps: integration and cementing change. So we've prepped them, we've clarified the vision, but vision without action is just a daydream. How do we make sure this change actually integrates? days.
Right, so step 4 is all about embedding the intention through repetition. Dr. Masudi calls it the Jim Carrey principle. The brain needs repeated, focused exposure to the new self-image. Otherwise, those old DMN pathways will just take over again.
Right. The story about him writing himself that $10 million check. He didn't just write it. He internalized it as a reality, and his brain started seeking evidence to match.
Exactly. So for the patient, this becomes the 30-day integration program. For the first 2 weeks after treatment, they have to do daily, focused mirror work. It's brief, just 2 minutes, but powerful. They look at their results and state their vision in the present continuous tense.
Why is the continuous tense, I am becoming, so important?
Because I am becoming the leader who speaks up, or I am restoring my youthful presence, signals to the brain that the transformation is happening now. It's not some distant goal. The brain immediately starts searching for the evidence of the becoming.
And then you add what you call the neural fertilizer.
Yes. After week 2, you layer in emotional intensity. While they're saying the affirmation, they have to recall a vivid recent moment where they felt completely themselves, totally confident and joyful. That emotional association releases dopamine, which is the brain's ultimate neuroplasticity enhancer. It cements the new pathway.
And this is where that custom service comes in. Giving them a custom 60-second audio recording with their exact vision language from the form, that's a huge differentiator.
Yeah.
That's 70% higher satisfaction score. I mean, that says it all.
It does. And that leads to step 5, which is the critical bridge from self-talk to real life. Channel passion into micro-action. Treatment gives them the confidence boost, but action has to paint the picture. So often, patients get great physical results, but they slide right back into old patterns, hunched posture, avoiding social events.
So you have to create a micro-action plan that's measurable and ties directly back to their vision.
Absolutely. If the vision is a woman who holds her head high, the actions need to be small, repeatable, and easy for those critical dopamine hits. Week 1, make eye contact with every service person you meet. Week 2, contribute one idea in a meeting without apologizing. Each tiny success is a microburst of dopamine that strengthens that new identity circuit.
I find the altruism amplifier part of this fascinating. Why include an action that serves other people?
Because it taps into our social wiring. The action is simple, like complimenting a colleague on their work. When we help others feel good, our mirror neurons fire, which reinforces our own positive state. It cements their transformation by forcing them to focus outward, away from self-scrutiny. It's a powerful feedback loop.
Okay, finally, step 6. Release attachment, embrace equanimity. This is all about cortisol control.
Yes, and this addresses the paradox of anxiety. The patients who are the most anxious, the ones obsessively checking the mirror, taking photos, stressing about the timeline, they're actually releasing cortisol. High cortisol impairs neuroplasticity. It makes it harder for the brain to form the very pathways they need to support their new self-image.
So you have to intervene in that anxiety spiral.
You have to. The coaching intervention is teaching equanimity, a sort of calm non-attachment. The technique is to take 3 deep breaths when the anxiety hits and state, I trust my body's healing wisdom. I release the need to control the timeline. This shifts them from that sympathetic fight-or-flight system back to the parasympathetic rest and heal system.
And that shifts the whole patient focus from, agonizing over some age reversal target to achieving a deeper sense of just feeling completely themselves, which is the real transformation.
It changes the entire outcome metric.
Yeah. Okay, so a practitioner listening to this might be thinking, this is fantastic science, but I'm a doctor, not a life coach, and I don't have hours of extra chair time. So let's look at how Dr. Masudi structures this to integrate seamlessly.
Right. The workflow is designed to minimize physician chair time. The critical work is front-loaded and delegated. It starts before they even walk in with an automated preparation for transformation email. That primes the RAS.
And on treatment day, the support staff handles the 5-minute vagus nerve technique and the vision clarification form. So the doctor's role is just to use those answers to anchor the treatment plan.
Exactly. And to address those mental obstacles, it immediately differentiates the practice because you're validating their internal journey. Then the post-treatment check-ins are key. The coordinator handles those and focuses them on the micro-action plan. A call asking, how did that first micro-action go, increases follow-through by 65%.
And the final move for retention and referrals, that integration check-in at 3 months, a 15-minute video call.
This is pure relationship gold. The question isn't, do you want more filler? The question is, what shifts have you noticed internally and externally? It forces them to reflect, which cements the learning. And this is the moment 80% of the time that patients will spontaneously mention someone else noticed a change. And that creates the natural referral opening.
Which brings us to the measurable business impact. When you compare the traditional model, which competes on price, versus this coaching integrated model, the numbers are just staggering.
They really are. Traditional practices see patient retention rates, between 35 and 40% for follow-up treatments. Practices using this neuroscience framework framework are reporting 72% retention. That's nearly doubling your repeat business.
And the referral data is even more dramatic.
Yeah, traditional patient referrals hover around 1.2 per year. With this framework, referrals jump to 4.1 per patient.
Let's just sit with that data for a second. We're talking about fundamentally changing the economics of a practice based on psychology, not a new device.
And when you run the lifetime value calculation, without the coaching, the LTV is around $4,100. With this framework, the average patient LTV jumps to $18,400.